Morning, today is October 7th, 2025. Present with us is Public Health Nurse Director, which would be Pam. Pam, do you want to start us off with what's going on in your department, please?
Yeah, thank you. We have been very busy for the last several weeks because it's respiratory virus season. So it's a time where we're very occupied trying to prevent respiratory viruses by vaccinating. We currently don't have a lot of illness and no flu yet. However, I've heard it's starting to pop up around us. So we're vaccinating far and wide. We're doing a lot of site visits. In fact, that's where my crew is today. We're going to all ends of the county doing businesses, schools. We've done county employee offices. Just trying to get in and, get folks that want to be vaccinated. We also have done some home visits, and then all three of our health department clinics have been actively involved in vaccinating. We have not vaccinated against COVID yet due to waiting for guidance from the federal government. And the CDC did approve the advisory committees on immunization practice, the ACIP's recommendations yesterday. So I have written a standing order according to that guidance and have sent it off to our medical advisor. As soon as that's signed, we'll start giving COVID vaccines. We have had some interest in those, and we do have some vaccine ready to go. So it's just a matter of getting the last signature on the line. And we do have a COVID outbreak in a long-term care facility that's kind of running rampant. And these folks are sick. It seems like with every variant, we have some different symptoms, and these people have fevers and body aches and don't feel well. So that's what we're seeing right now. So it's
Any
time
particular age group?
They range in age from 30s to 80s.
Okay.
Yeah. So, and then we will be providing community vaccination clinics the week of the 21st. We'll be in Whitehall on that Tuesday. Let's see, that's the 21st, and we'll be here in Boulder on the 22nd and in Clancy on the 24th with the caravan. And when we partner with the caravan, we're able to provide no cost vaccinations because Blue Cross Blue Shield picks up any cost that is incurred. So people may get an EOB from their insurance company, but there's never a charge for those vaccines. So that's kind of a great service.
What were the dates again, Pam?
It's October 21st in Whitehall, October 22nd here in Boulder. We'll be at the volunteer hall at the fairgrounds. In Whitehall, we'll be at the ambulance barn, and on Friday the 24th, we'll be at the public health office at the Old Red School building. And our hours will be a little extended too. We run those from 3 to 6 so that we can try to accommodate after school and after work as much as we can on those days.
Do people make appointments for that or just show up?
What was that?
Do people make appointments for that or just show up?
I still didn't hear what you said, sorry.
Do people make appointments for that or just show
Yes,
up?
we can do walk-ins. People that have an appointment get, preference and timing. But yeah, we have enough vaccine and we are always welcoming walk-ins. We do have information in the newspaper and flyers around and about. It's on our social media, and there's QR codes for each. So they can use a QR code or they can call our office and we can get them scheduled. So yeah, that's that with flu. And we haven't had a lot of other illnesses. We did, however, have a West Nile virus that was reported to us, and that's an unusual one. The person had traveled to Iowa, and we feel like that's where that mosquito got her. She was pretty sick and she was hospitalized and has had antibiotic treatment. So she is recovering. And let's see. The other big thing on our plate is We've been working to hire a behavioral health coordinator with that near-term initiative grant funding. We conducted interviews last week for 3 candidates. We did offer a job and it was declined, so we're still in the process of trying to offer the job. And then we have State of Mind coming to Jefferson County tomorrow. They will be partnering with Jefferson High School to get some voices of our youth, and then adults, school staff, medical people, law enforcement, emergency medicine. I gave an invitation to Craig if one of you guys wants to come over. We've invited some of our faith leaders so that we get that faith community's input from the adults. And that's at the high school from 2:30 until about 4, I would imagine. It'll be about, they say 75 minutes, so a little wiggle room there. And then they'll take all of that information and all of those things that they've heard and incorporate it into their performance, into the play. And that's going to be at the community center in Clancy tomorrow night at 6:30. All are welcome. It's free. And then we'll have a coffee and conversation activity at the Elkhorn, the Sweet Spot Elkhorn, tomorrow from 9 until about 10:30. So you're more than welcome to come to any of those. We'd appreciate your input and support in that. So those have been pretty big things we've been working on. I know Jesse's been doing some earthquake messaging and preparedness because it's the Great Shakedown. I think he told me 16th. So that's coming up too. Anyway,
That's what you've been up to, huh?
yeah,
Good. Sounds like you're busy enough.
I think so. Yeah. Yeah. The monitor asked me if I wanted to apply for another grant that they had found, and I said, the 5 I manage are fine, and I think my financial folks might not be happy if I applied for more.
You did get $23,000 today from your term initiative.
Oh, okay, yeah, good. So, anyway, do you have questions for me?
I don't think I have any questions, no.
All right.
And, you know, we are still working with the sanitarian, providing support for him. That seems to be, I think it seems to be working well. This is a hard time for Molly to have extra time to provide to Matt. But Matt's in and out of our office a lot. He's, I think, appreciative of, you know, the camaraderie and support. So we've moved some of his files into our office so they're more convenient for Molly, which I think makes them less convenient for him because then he has to come visit us. So, you know, that whole building expansion thing is something that we probably need to keep considering. So,
Matt said it was really nice to have Molly helping him, so it's really taking a lot off him, so making things much more efficient for him, and he's able to focus on the contract people and keeping them more efficient. So it seems like everything's working pretty good right now.
yeah, I think so. I know his contractors are experienced and they're really open and helpful, which makes that good. And then, like I said, I mean, this is part of my vision for public health in general, is to have both branches, you know, have collaborative work together. So it has also, you know, put extra responsibility on the rest of my staff, because when Molly's not there, we have more walk-in, we have more phone calls, we have had, you know, extra traffic in our area. So, but they've all stepped up. They're good folks.
Yeah, you got a good crew. Got a good crew there.
Well, if there's nothing else, I'm gonna head over to HR and talk about this job position, see what we can do with it.
Sounds good. Thank you,
All right.
Pam. Appreciate it.
Thank you.
My vote is to